Hi, thanks for joining us on the Nourishing the Community Podcast, where we're going to be talking about all things happening in the community with nonprofits and community needs and how you, the listener, can get involved and make some change. I'm your host, LaDonna Parham. This is my co-host,
Norman Hanks. Welcome to the show. Welcome to Nourishing the Community Podcast. I'm Norman Hanks, your host, and today in the hot seat we have one of my dear friends, Miss Kristen Swann from the United Way. How are you, Kristen?
I'm great. Thanks for having me.
No, I'm so excited to have you here. So I'm going to ask you to tell us a little bit about United Way, history of United Way, what you do at United Way, and then we'll jump into like some other stuff.
Okay. Make sure my microphone.
You feel like the mic's too far away?
I don't know. Is it, Trent? Am I good? Okay, cool. So I'm Kristen Swann. Like Norman said, I work at United Way. I've been there for 9 years, and we really have changed so much as an organization in that 9 years. When I first came to United Way, we were more of a traditional model where we raised money, gave it to other nonprofits. We still do that, and my department is kind of in charge of grants and things like that. Giving out grants, but we also oversee our internal programs, and that's where we really grown as an organization. So in 2019, we went through a process really just to identify what are some of the biggest challenges in our community, and I'm sure you were involved with that, Norman. I don't remember that far back because then COVID happened. So,
right. We all survived the pandemic.
I'm sure, exactly.
And, right.
I'm sure you were involved, though, and we really did. I mean, the things that came out of that, we did surveys, we did community meetings. Would not shock anybody, right? So affordable housing and supporting those who are working in our community but aren't able to afford the true cost of living. So we consider that kind of financial stability, economic mobility, which is, I think, the area that Nourish most aligns with. And then mental health and substance abuse and early childhood education. So not only care for children so that their parents can go to work, but also, making sure that we have high quality education for kids before kindergarten so they can enter kindergarten ready to learn. So that's what we're, most focused on. That's what I spend every day thinking about, day in and day out. There's lots of different ways that we try to tackle those issues. Obviously, we certainly cannot solve those alone, and that's why we try to partner with as many folks as we can. But yeah, that's kind of what we do in a nutshell.
Okay, awesome. I'm glad you brought all of those things up because that leads me into the first question. Alice, right? This is what we are basing the 2030 bold goals on. Is that correct?
That's one of our bold goals, yes.
So explain to us what Alice is, because it's an acronym. It does not stand for some woman's name.
It's not.
And how we identify families that sit within that threshold.
Yes, I'm so glad you asked that, Norman, because first of all, there's some new data that came out last week, so I'll share that as well. But ALICE stands for Asset Limited Income Constrained Employed. So if you've heard someone talk about the working poor, it's really an acronym, I think, that it's not a person, but I do think it tries to give more of a face and a voice to that population in our community. So what happens is we have a percentage of folks in our community in Rutherford County that are at or below the poverty line.
And do we know what that number is?
I want to say it's 9%. Don't quote me.
I
might need to
feel like it would
verify.
be higher, but okay.
Yeah, well, that's where I think it gets tricky, right? Is because the poverty line is really what's based to determine a lot of government programs, things that you're eligible for. And above that, between the poverty line and what is the true cost of living in our community, there's a large amount of people. And so we always say that almost half of Rutherford County is at or below the ALICE threshold. So that threshold is really what it costs to live here, the true cost of living. And I was looking at the numbers just yesterday, and I think for a family of 4, 2 adults working or 1 adult working, we have a lot of single parent households with 2 children in childcare, because that goes back to that other piece, right, of how expensive it is and how hard it is to find childcare. I mean, they have to just live here, to just survive here. They have to make $75,000 a year as a family. If they want to be stable and actually have money for savings and things like that, they need to make almost $100,000 a year as a family to be able to live in Rutherford County.
That is absurd.
It's a lot of money. And I think that that's where we have these misconceptions about folks that are experiencing financial instability. They're not working. they're lazy, it's their fault, it's their choice. And that's just not true. That's not what the data tells us. And that data comes from the United Way of Northern New Jersey. I was going to say the woman that started it worked at Rutgers.
Okay.
And so she really started the project. She's an economist. And I think they just kind of realized, like, hey, these people are, like, we all know it exists. We all see this phenomenon that is the benefits cliff happening in our day-to-day work. And she just kind of put a number to it and a face to it. So unitedforalice.org is where all that info is. Super fascinating. You could really go down a rabbit hole because they have stability budgets. They have survival budgets. And what they released last week, which is fascinating, and you need to check out for your work, Norman, is an economic viability dashboard. So one of the things that it talks about is how many folks in our community are cost burdened with their housing, right? And when we talk about Alice, I mean, I'm not going to even say a percentage number because I'll butcher it, but it's obviously when we're talking about the Alice population, that number goes way up of people who are cost burdened, who are spending more than 30% of their income on housing.
Right. And in this community right now, we know it's impossible not to.
Absolutely. So that information, again, unitedforalice.org, super fascinating. Lots of different, you can look it up by zip code. You can look it up by county. You can look it up by Smyrna, Laverne versus Murfreesboro. It's worse than Smyrna. I will just go ahead and tell you, which is interesting. But yeah, it's fascinating to see. I think sometimes we know the problem is out there, but to be able to have the data and the numbers, the data that they use comes from the census and also the COLI, which is the cost of living index, which is locally, I think, helped our local chamber of commerce helps contribute to that number. But if anyone's interested, like, where are we getting these numbers? Like, that's where.
Awesome.
Yeah.
So that leads me into another question.
Okay.
So that's a lot about Alice. And I know there are certain things in the Alice, because I fell into that hole yesterday by accident.
Yeah. It's fascinating.
I was trying to find
is.
numbers, and I was like, wait, look at the website, stupid, and figure it out, right? But there's a list of things that is looked at, right, to determine if a family falls within that Alice threshold. And I know that in the Alice system, right, it said something about a 10% of your salary savings.
That's for the stability budget. So when they released the new data, they did a stability budget, which is what I was just talking about, where they are trying to account for savings, because before they just did the survival budget. So it was like, this is what you need to make to survive. And I think that's really important to look at, because when we talk about those who, let's just take homelessness, for example, or food insecurity, really any issue, not having access to childcare, like literally any issue.
Any issue.
The problem is when someone is living in survival mode, any type of crisis, health crisis, a car crisis, can really send them in a spiral.
Yeah, and we talk about this a lot. Like I've talked about this on the podcast before. Our clients are not coming to us because their dream was to come to us, right?
Absolutely.
No one dreams of going to the food bank
You're
because
right.
they can't go to the grocery store. No one dreams of having to ask someone for a place to sleep at night because they wanted to live on the streets, right? And all of our clients, and I tell my staff this every day, all of our clients that walk through our door are in a moment of crisis. And it is not our job to judge.
No.
It is our job to feed them and make their life a little bit better.
Right.
Right?
Yeah.
And I think that's where you're headed.
Yeah, absolutely. Just, I think that as we respond to things in our community, yes, it is not our place to judge. But I think we also have to consider why are people in this place in the first place, or in this situation in the first place? And that's a hard question to answer, because there's a lot of different factors, right? And so I do hear people say, have said to me, well, it's choice. Like, someone chose to do this. And I think that, let's just talk about predatory lending, payday loans. So, yeah, that person chose to get a payday loan, but was it really a choice?
Was it a crisis moment they were in, and that was the only option they had?
Right. When you only have one option, it's not really a choice.
It's not a choice.
So I think that's one of the things that we do talk a lot about, is not just financial stability, because we want people to be financially stable, but we also want them to be mobile, economically mobile, where they can go from where they are to somewhere better for their family and for themselves. So, and I think that, organizations like Nourish, it is so critical to address a crisis, right? Because you can't, like, that's another thing too. We talk a lot about, well, we want to teach a man to fish, not give him a fish, whatever. And I'm like, yeah, but like, we don't want him to starve before he gets to the fishing part,
Right.
So I think it's all important. I think that's why community response is so critical.
Yeah, boots on the ground, right?
Yeah.
I'm so grateful for what we do every day. So talking about all of these things leads me into bold goals 2030, okay? And I know there's 5 bold goals, is that right?
There's 6.
6 bold goals. And I want you, if you will, if you can, to sort of tell us what they are, give us a snapshot of what it means to you, and then let's sort of dig into it a little bit. Yeah.
Okay, so what I was talking about kind of earlier, in 2019, we did go through the process to determine what are these issues. And so what came out of that were measurable goals. I'm not going to recite them. They're on our website. So it's helping people come out of ALICE. It's helping people afford housing. So we do look at that 30% of income on housing number. That has not improved. It's gotten much worse since the pandemic, unfortunately. So a lot of folks are cost burdened with their housing here. I think like over 53% the last time I looked. So that's
let's talk
great.
about that one.
Okay.
Okay. Let's focus on that one for a minute.
Okay.
So
it's a lot, and it's all interconnected.
It's all interconnected. Yeah. So the 30% of population or the
income,
right? We want to get to a certain point by 2030 where it's not a 30% of your over 30% of your income in housing, right?
Yes. So what we want to see happen is that a percentage of we want to see that number increase. So I will tell you, so we have a dashboard on our website where we're measuring this information from 2020 to 2021. This is also not shocking because of the pandemic, but we went from 73% of folks were not cost burdened, right? Because that's what we want. We want that number to go up. We went to 53%. So that's not good. We went the wrong direction. So more people are cost burdened. So yeah. And then I think that's
how do we change that number, right? Like we aren't the ones setting the rental cost or the housing cost.
Yep.
We're not the ones setting the income amounts for the people that are paying these costs. So how as organizations like Nourish, Journey Home, community, all of these people that we work with on a daily basis, how do we change that number, right? Like I want to see how we impact that, right?
So if I had an answer, if I had a magic bullet, we wouldn't be sitting here and we wouldn't have jobs and we wouldn't even be having this conversation. But what I love so much about my job and what we do at United Way and what all of our nonprofits do is I think we're all problem solvers, right? And so we have to know what the issue is before we can solve the problem. But one of the things that you have to do, I think, within problem solving is you just have to dig in. Why? Why is this happening? Why? There are multiple causes to any of these large systemic issues. There is not one size fits all. I can't say if everyone does this, we will all be fine. But what we've done is we've broken down each bold goal into a list of strategies. So within that strategy, what some of our experts that we've worked with on this issue are saying is workforce development, right? If you earn more, that percentage goes down. If you're paying the same amount of housing, but you're earning more, then you're less cost burden. We've looked at providing supports like food, clothing, those sort of things. Some of the other things we've looked at are increasing education. Increasing education helps to increase that workforce development, right? So there's a lot of different things, and I think that from a systemic perspective, there's not one answer, unfortunately. But I do think that looking at what are the barriers people are facing, because you named it, Norman, you're completely right. When people come to you, they're in crisis. They are not thinking about getting a post-secondary degree, right? We know that would certainly help them be able to earn more, that sort of thing. But I think one of the things that we can talk about collectively is how do all these pieces work together? Let's say you're step number 1 in triage, right? Like you're like, we're going to help you put a Band-Aid on this bleeding or whatever. And then, but after we do that and after you have a minute to breathe because you're not worried about your children eating, what's the next step? And I think thinking about services in more of a continuum is a way forward. I don't think it's the only way forward. I don't think it's the answer. It's not easy. It's messy. And I think that as much as we want to say, like, let's just map this out and we can figure it out, we're still dealing with humans who have, you know, the right to make choices and do things like that. So anyway, I do think that it is a community response. I don't think that any one agency can solve everything, and certainly United Way can't. But I think that we are trying to make a more concerted effort to bring people together around, okay, these are strategies we think that will work. How do we address that? So,
awesome.
Does that answer your question?
Yes.
Okay.
It does. So other bold goals, that's just the housing portion of it.
That's just housing.
There's also mental health involved. Talk about that one for a minute.
So mental health and substance abuse, that's actually an area that we invest the most of in our, when I talk about invest, we have a community investment fund that, you know, our donors put in. That's what they invest in. So mental health and substance abuse, obviously a huge problem in our community. And one of the things that we've noticed from talking to experts, talking to agencies, is that co-locating services is a really impactful strategy. So we've invested in programs in the school systems. We've invested in different programs that are, again, providing, you know, discounted or free mental health services. We have an internal program called Single Care, which I think a lot of people are familiar with, but some aren't. And one of the things that's interesting to me about that is the second most popular prescription. So it's a prescription discount program. The second most popular with that program is an anxiety medication. So we know that it's obviously a community issue, and so we want people to have access to those medications if they need them. So yeah, I mean, I think, again, it's about that community response. It's about, okay, what are the things that we can focus, because everyone has a finite amount of time, money. I mean, you know, so we have to kind of figure out what do we think is going to work, and that's where we invest our dollars and our time.
Right. I love that. You know, you said co-locating, and Nourish has been working on co-location for 5 years.
Yeah. Yes.
We're very proud of what we do over at the Hub. And even though we've lost several nonprofits this year, we are bringing in new partner agencies. We've brought Interfaith Dental into the building. We've brought Volunteer Behavioral Health into the building. Good. They are meeting with clients.
That's awesome.
While they're we're really doing what we can to sort of co-locate as many resources in one space as possible.
Because I'm sure you know from serving so many clients, Norman, that it's never just one thing.
Never.
It's never just like, I need food.
Right.
It's never, because again, when you're looking at the root cause of an issue, it's always going to be complex. And so I think that's awesome. So glad to hear that.
Yeah, we love it. We just started a wraparound services program. Gosh, 2 years ago now, I think. Which is a great program. You know, we get clients, like you said, in crisis every minute. We're serving 50 families a day right now. Like, it's insanity at both of our sites. So it's a lot. And food is not readily available, right? So we have this wraparound services coordinator who is truly amazing at what she does. So a client comes in and they need a job. They need a license to get a job. They need a pair of shoes for the job that they just got, whatever it may be. She's able to help them with that.
That's great.
She's also so involved with her clients. Like, she follows them from the beginning to end, right? Like, we've got one client that we put in housing back in November, I think, and he's currently being successful at that.
That's awesome.
But we did that in partnership with Barnabas Vision. So, like, you know, we don't have the funds to pay for your apartment this month, but let's see what resources are out there, right? And she's good at that.
That case management piece is one of the strategies that has been identified. And I mean, none of this is surprising to anyone, especially in the nonprofit community. It's all like, yes, we know. But I think just trying to like hone in on that and focus on it. So the thing about case management is we have learned, you know, from our partners and from the community, that long-term case management coupled with direct support is really one of the most, successful strategies out there, because when you're talking about someone that's in crisis, we know that like they're literally not, like their brain is not able to process as much information. And so they need someone, I think, to say, okay, this is what we're going to do. We're going to step by step, we're going to figure it out, because they're in the tyranny of the moment.
Yep.
They are
they're lost.
Overwhelmed.
They're overwhelmed.
You're
and
right.
Once that overwhelmed feeling sets in, any of us can say we've all experienced it at some point,
Yes.
right? Your brain literally shuts off. It stops functioning the way it's supposed to because it doesn't know how to process everything that it needs to. So it has to focus on one specific issue.
Yep. Fight or flight.
Fight or flight. That's exactly right. And if you can make it into our doors, right? If you can make it to Nourish, most of the organizations in the community are like this. You will find that immediate relief. But then you're also going to find someone that's going to walk with you and help you process the trauma that you're experiencing, as well as all of that crisis moment, right? Whatever it may be. Maybe you're in crisis because you lost your job last week. That's stress inducing, right? And stress is what causes our trauma and our crisis. So you get with the right person and they're like, oh, well, we're going to get you placed tomorrow. Are you ready to go back to work, right? And God bless our wraparound services coordinator. She will have someone working within 24 hours if they actually want to work.
That's amazing.
Yeah, she is on it. And we have great partnerships with employers in the area. So
that's awesome.
Yeah.
Well, I'm glad to hear that. Yeah, I think that is one of the ways, like you're talking about, like how can we solve this? I don't think there is one solution. I think that's what makes it so complicated. But yeah, I'm so glad to hear that.
Yeah,
that's awesome.
I think it's great that Nourish partners with so many agencies in Rutherford County, Middle Tennessee, right? Just like United Way, only we don't give them money.
Yeah.
We give them food and support. But we have great friends out there. And I think, so part of what Nourishing the Community podcast is about is bringing those friends together so the community understands the work that we are all doing, right? So that it's not silos all over the place.
Right, yeah.
We're trying to create these barns, basically, for everyone to be in together, right?
Yeah.
And these moments where our clients are able to get the help they truly need.
Yes.
I don't know what time it is. I feel like I'm talking and talking and making you talk and talk, and I'm sorry.
That's okay.
So back to bold goals.
Yes.
We've talked about housing. We've talked about mental stability, substance abuse.
Early childhood.
Yeah, we can talk about early childhood. That's not one of my favorites. I'm not going to lie.
Norman does not care about the children. I'm just kidding. I'm totally kidding.
Children.
No, I'm just kidding. I'm totally kidding. Yeah, so I'll just touch on it briefly because I think the thing that's really interesting about early childhood is that it's not just about we're babysitting these kids. It's about
education.
80%, 85%. I've heard this statistic, but a large percent of your brain develops by the time you're 3. And so when we're talking about, let's just use this as an example. By 3rd grade, we need to be reading at a certain level. And our legislature recently passed this. Okay, if you're not doing that, then we have to do an intervention. You have to go to summer school, etc. Well, if that much of your brain develops by the time you're 3 and you've had no exposure to language, you don't have books in your home, your parents are not able to read, that's more common than we think it is. How are you going to be ready for kindergarten? And then you're going to be behind when you start. How are you going to catch up? And so I think that's kind of part of our reason we want to focus on this is that it's very much twofold. One is that it's an economic development issue. If our folks in different employers don't have childcare, they can't go to work. I mean, it's really just that simple.
I mean, we talked about this, 5 years ago? Was it 5 years ago we had this conversation?
Maybe, I don't know.
About creating overnight childcare.
Yes,
do you remember?
Yes,
we worked
with Nissan. Yeah, I do remember
We were talking with several organizations, several businesses in town, big businesses, and we were working with, Lord help us, the mayor jumped in and got involved.
Yes,
remember that
that's
situation?
Right.
And we were talking to the senior center out in the country. I can't tell you what road it's on.
Okay.
I just know it was out in the middle of nowhere for me.
Yeah,
But we were talking about creating an overnight childcare situation, and because there's not any, right? Yeah. And the majority of jobs available right now are those second and third shift jobs that a lot of our clients would be glad to have, but they have nowhere to put their children.
Right.
And so it's that endless cycle.
And they're all, so that's, I think, going back to like, they're all so interconnected in that, you know, what is the business community? What's their contribution? What's the nonprofit's contribution? What's government? You know, it's such a complex issue, and there's so many different ways to look at it and sides of it. And I understand all of those. I really do. I think that when we talk about community solutions, it's not just the nonprofit world, it's everybody.
Right.
You know, so going back to the childcare, we want for our children in our community for them to have high quality, affordable childcare. I mean, it's just, Laverne is considered a childcare desert. The amount of again, going back to the Alice population, if we look at children living in Alice and Murfreesboro, only about 20% of those children are enrolled in pre-K. So that's 80% of kids that aren't getting, you know, and they probably are. They're probably receiving great care if they're at home, for example, if they're being cared for by a family member. They're probably receiving exceptional care because they love that child and they want them to be safe. But if you didn't finish high school, if you are illiterate and can't read yourself, you're not going to be able to pass on those skills to your child.
So I'm going to ask you a question while we're talking about pre-K, because I remember the days of trying to get the kids into pre-K.
Yes.
There's only so many pre-K programs out there.
Yeah.
And so only so many kids can get into it.
Yeah.
So what is the fix-all, right? I mean, my kids, when my mother took in my nephews, 20 years ago, 22 years ago, whatever it is now, I stayed home with the kids for the first 5 years that we had them.
Yeah.
Because it was cheaper, right? She made income. I was never going to make as much as she was.
Right.
We were going to be spending thousands of dollars in childcare.
Yep.
So it was just cheaper, right, for me to stay home and take care of them.
Yeah.
But I remember trying to go and get them into preschool. The first one did get into pre-K at Smyrna Primary. His little brother, however, did not. And so, and there was only one pre-K class for 20 kids. Well, that was the only option we had, right? I mean, we got him into a preschool type program, but it was not pre-K.
Right.
So I just, it's, you know, we say we want to change these things, but again, how do we change these things when we have no control over what's happening?
Yeah, I mean, again, there's no magic, bullet. Right. If there was, that'd be amazing. But I think just like knowing what strategies can work, right? So advocating. I mean, honestly, advocating to our government, to our legislature about this issue. There are states that have universal free pre-K. Alabama's one of them. So that's one thing you can do, you know, if it's something you care about.
I never thought I would hear Alabama be a goal to live up to.
Well, and I'm from Mississippi, and so, like, we always joke that, like, thank goodness for Mississippi and Alabama, because, like, you know, everyone's like, oh, or at least we're not Alabama in Mississippi. But yeah, you're right. And so that, I mean, that I'm just using that as an example.
Right. No, that's awesome.
That is something that you can do, but something that you care about. Ask your representative what they're doing about early pre-K. What are you doing about it? Is an issue that's on your radar? You know, things like that. That's something that you can absolutely do. We partner with the Tennesseans for Quality Early Education. It's nonpartisan. You know, it's not about one political party. It's about the issue of quality early care for our kids. And so they have a ton of resources and information that you can use to advocate if that's something you're interested in. But then I think going back to, you know, United Way's response too, is there's a couple of different things. So it's not just about, hey, we need more pre-K seats. We absolutely do. It's not just about, there's other strategies. So one of them is books in the home. And so we, you know, run Dolly Parton's Imagination Library for Rutherford and Cannon counties, which everyone loves Dolly, but she does not pay for the books. And everyone thinks that she does. But we raise money for that so that any child, regardless of income, regardless of household status, can have books in their home. But then you kind of couple that with, again, this is like the problem-solving part of my brain. What if your caregiver can't read? It's very possible. So we also fund parent engagement programs. So we fund Nurses for Newborns. We fund Nurture the Next. These are in-home visitation programs that help parents kind of identify what's going on with my kid. Do they need early intervention? Things like that. We do a program called Born Learning where we're teaching parents to be the child's first teacher, because your caregiver is going to be, even if you're in an amazing pre-K, your caregiver is still with you way more than your teacher is. So there's a lot of different things. There is no one solution to these problems. And I think that's kind of my message, why I love my work and why I love this community, is because we have so many partners like Nourish and others that are committed to these really complicated solutions and digging in.
Yeah.
So, yeah.
Yeah, I love to get into a problem.
Yeah.
I'll find a way out of it.
Yeah.
Yeah, I love problem solving. So that's early childhood, mental health, substance abuse, housing. I'm missing 3. I'm missing 3.
So yeah, there's 6 goals, but we kind of put them all in those 3 categories, if you will, because it's just it's easier to talk about. The other one we have looked at physical health, but I think really in our work we're just starting to consider how physical and mental health are so connected. And so I think we're kind of reimagining maybe what that looks like. But I think it's really about kind of what are the biggest things facing our community and how can we address them. Yeah,
that's awesome.
Yeah.
Kristen, thank you for coming.
Yeah,
I know we can
me.
find you at yourlocaluw.org.
Yep, that's
correct?
Right.
Yay, website.
Yes.
Are y'all on any of the socials? Facebook,
Yes.
Twitter, not the Twitter, the X, what is it
I
called?
believe we're on that, yes.
Anyway,
We haven't
TikTok.
TikTok. I don't think we're on the TikTok. We have an amazing marketing person. Her name is Haley Adams. I just want to give her a shout out. I told her I was coming on your podcast, and I was like, I'm not going to say anything embarrassing or like mess up, because she knows all the things. But I know we're on Facebook. I know we're on Instagram. I do not think we're not on TikTok. I know that for sure. I think we're on X.
Do you know what the handles are? I think is the word. No?
Absolutely do not.
Okay. That's okay.
That's why we have Haley, and that's why she's amazing. They're all linked on our website, though. I do know that.
Okay.
Mm-hmm.
So just go straight to your local UW.
Your local UW, is our handle.
Yourlocaluw.org, and then you can find all the things.
Yes.
People want to donate. That's the best way to do it. People want to volunteer. How do they volunteer with you?
There's a volunteer button on our website. We have a platform called Volunteer Connect. Shout out to Volunteer State Bank for sponsoring that. Always got to give props.
Yes.
But yeah, it's super great. And I think you guys are on there too. So any nonprofit can have a profile on that website. It's not just for us. And so you can go on and if I'm a volunteer and I want to go make a profile and I'm like, I'm really interested in sorting food, or I'm really interested in helping with, food insecurity or something like that, then it would, anytime Nourish posted an opportunity, it would kind of notify me via email that it was posted. So we have a lot of folks that sign up for that. Groups, you can do groups, you can sign up for an entire volunteer team. It does the waiver for you, so you don't have to worry about a volunteer waiver. So yeah, I would really encourage. I think there's 60 agencies on there the last time I checked. So it's a great platform. Awesome. You can find it. It links from our website.
yourlocaluw.org.
Yes.
And I know there's another question. Major events. Do y'all have any major events coming up? Anything happening?
Always.
Yeah.
We always have an event. So we have, speaking of early childhood, we have our Baby Basics, which is where we collect baby items for new moms. So diapers, bottles, onesies, all the things. That is coming up this week or next week. I'm also not in charge of that.
You can find it on your local UW.org.
100% on our or on our social medias.
On your socials once they find it. Yes.
So that's coming up, and we do have a birthday bash for Dolly that got postponed because of the snow. That's on February 22nd, and that is raising money for Imagination Library. So lots of fun stuff to support early childhood coming up.
Awesome.
Yeah.
Well, Kristen, thank you for coming and talking to me today.
Thanks for having me.
I hope we taught people a little bit of something.
Yeah.
It was great to see you.
If we didn't, it was just great to talk to you, Norman.
It's just always a fun time to hang out. I love it.
Always good.
Awesome. And as always, thanks to our producer, Trent Denson, who spread the positive, bringing light to what's going right in our communities. Have a great afternoon.
Thank you.
Hi, thanks for joining us on the Nourishing the Community Podcast, where we're going to be talking about all things happening in the community with nonprofits and community needs and how you, the listener, can get involved and make some change. I'm your host, LaDonna Parham. This is my co-host,
Norman Hanks. Welcome to the show.